You can take
you,
over
Dr.
the
Sahani sir, and all those participating in this session. Good morning, good afternoon, and good evening. Welcome to 1567th day of continuous and uninterrupted Zoom session of IFPH. Let's start today's program with a silent prayer for 1 minute.
Good evening, sir. Am I
wait.
audible?
Madam, you please wait. Let Dr. Manoj introduce you. Okay.
Okay.
Thank you and welcome back. Today we have with us Dr. RAKSHA THAKKER, BHMS CCAH, Chief Physician, Innerville, Veer Sarvarkar Mark, Thane, Mumbai. RAKSHA THAKKER guides the budding homeopathist and practitioners through her initiative Homeopathy Advanced Learning Center, comprehending rubrics through case presentation. And today's topic is pediatrics and homeopathic approach. We all know that the role of homeopathy in pediatrics and a lot of positive output has come from this pediatrics. So on behalf of IFPH and Dr. Thakkar, you can have the platform for the next 45 minutes. Over to you. Please proceed.
Now you can start, madam. Yes, madam, you can start.
Okay. Good evening, sir. Thank you, Dr. Sani sir, Dr. Dhanesh sir, Dr. Bob sir, and
Dr.
it's
Manoj
a
is here.
privilege,
Your host is
Dr.
Manoj.
Mehmood sir, and all of my IHPA family. So it is always a pleasure. I've already taken session in this platform, and it's like the family calling again to be the guest speaker as an honor for me. Thank you so much. Hereby, we start with our session.
Yes.
All best wishes to the team. Can we have the PPT slide sharing, Dr. Abhida? Thank you so much for that. So, pediatric and homeopathic approach. Usually happens that in pediatric, we are not able to elicit the symptoms because the kid is very small. Okay, so we can rely on the attendant. The attendant could be mother, father, or somebody who is nursing or is a guardian to the kid. Okay, but in these cases, observation plays a vital role. Okay, so this is my contact info so that you can get in touch with me. Next slide, please. So, with the blessings of the Almighty Lord, we begin the session for the day. Wait, next slide. We bow our head to the creator of this most beautiful science, that is homeopathy, our father, Dr. Christian Frederick Samuel Henneman. It's his grace who has bestowed this wonderful pathy to us. Thus, we help heal the kids as well as the adults and the patients, the souls who are in agony. Next. So, Initiative Learning is the team group name where I guide the budding homeopaths and the senior practitioners as well. Thanks to the team, International Forum for Promoting Homeopathy and Malaysia Homeopathy Health Group, my extended family, Dr. Sayajit Kudiat, Dr. Shani sir, Dr. Bob sir, Dr. Dhanesh sir for the initiative and inviting me to share my views. Thanks to all the delegates for joining in. Next. So, now when it comes to the kids, see the slide which is shown. The innocent childhood is gone. Those times of pure joy and happiness replaced by video games and iPhone. Where we are all heading to? The child is given gadgets. They keep on crying and then they are given the gadgets. Okay, now you be with the gadgets. So, if that we are also busy with our work, you also be with the gadgets. The park are all empty. No kids, nothing there. And just gadgets. So into the world of the tiny tots, the little munchkins. Now let's see what the munchkin has to say. You won't believe there was a teacher in a class and the kid was asked to write an essay, okay, on the mother, father, parents, family, okay, basically. Well, I wish I could be a gadget. asked why, because these people, they are always on the gadget. So I wish if I could be a gadget so that I get all the love which the gadget is getting. So this is the impact on the psyche of the kids. Okay. So into the world of the tiny tot, the little munchkins, embarking on a great new journey of the innocent creation of the Almighty Lord. They are very innocent, very naive. And pediatrics is the branch of medicine that involves the care of infants, children, and adolescents. Here, observation plays a vital role in pediatric case receiving. Observation, now that is attention with all senses. So, when you consider attention of the all senses is I listen, I hear, I observe, I see. Like we had in that school experimentation, observation, conclusion. When you are observing, all the senses are alert. When you are listening, your senses are alert. I hear to the song, I listen to the music, which is melodious to my ears. Then, when it comes to observing, it is keen observation like the Arjuna, the bird view. Okay. So, next slide, please. In pediatric cases, observation is important. But what is more important is what to observe. Observation is also the mind will see only what we know. Okay, so the eye sees what the mind knows. If you are ignorant about it, then the mind will also not be able to pick up. Okay, it was Arjuna's bird eye view, where everybody could see the surroundings. Okay, the plants, trees, the mountains, the valleys they could see, but Arjuna could see only the eye of the bird. And it was like, I have got to target this. My main focus has to be this. So usually what happens is there are play areas in the clinic where the child is allowed to play. Let them play. And just observe what the child is doing. Okay. And accordingly, you will get clues to your prescription, thereby helping you reach the minimum. Next slide. So just see what the kid is doing and what the dog is doing. Okay. So the kid is observing. The dog is trying to climb on the sofa. Okay. The kid is also trying to copy. So at this age, they try to copy you. It so happens that there are discords between the parents, mother and father. Okay. That also child is, and it has a great impact on their psyche. So when any discords between the parents, be very vigilant, and the child could have a great impact. So this child can later be turning into resentment. There could be bitterness as well. My mom, dad is fighting. There is no scope, nothing left in the life. And then they lag into magnesium group, feel like an orphan. Orphan feel we have, no? Like, why they feel so? In spite of being in the house, it's not only orphanage kids feel so. In spite of being in the house, but the lack, that vacuum is there. Okay, and because of that lack vacuum, they feel so. Next slide. It's important to observe non-verbal clues. And 7% weightage is given to the verbal communication. Only 7% as per the communication chart. 38 is the body language, 55 the tone gesture. Okay, so it so happens that we give weightage to that 7%. But apart from that, the body language, gestures, the non-verbal communication holds prime importance. So we need to pay attention to the verbal as well as the non-verbal as well. The areas where gestures in the clinic, how the child behaves, the activity of the child, that holds importance. And during sickness, prior to the sickness also is important. Indicates the energy. Some child, like say belladonna, will be playful even during the fever. Okay, but It so happens a child who is very much drained out, gelsemia, torpor. So they are very much lethargic. The arsenic child will be restless. Okay. So first we will child development. The infant, it's called infant under the age of 1. The toddler is 2 to 3, preschool 3 to 5 years, child 6 to 12 years, adolescent 12 to 18 years. Developmental milestones are important. Here with these stages are compared to the Erikson psychology as well. And as section proceeds, we would be giving a gist of the Erikson psychology. Okay. So next is this is normal child development. As I said, the infant up to year, then goes toddler, schooler, and schooler. Adult, adolescent. These are the various stages of development a child undergoes in his life. Okay. Next slide. So reminiscing our childhood days, the days when we used to go to the park, play a lot, and during that time there was no gadget. Okay, it was like 13 years back, almost 13 to 15 years, the introduction of the gadget, and now the parks are empty. So as in Hindi, see, this is no doubt an English session, but it is a saying in Hindi, "Lauta de mujhe wo bachpan ka zamana," meaning I want my childhood days back. So happy, no tension, no stress. Okay, so reminiscing childhood days. Yes, next slide. See this mom. Okay, mom and the kid spending quality time with each other. Some of your day schedule, say half an hour at least for your kid. But here the mom has to juggle between the two, like household as well as office. So fuming and fretting and have your breakfast fast. Don't you understand? They always conditioning. No, you're not supposed to do this. No, you're supposed to do that. Okay, so don't condition your child. The child needs love, protection, affection, and care. Give the child the same. Spread love. Make them feel secure. See, and it so happens now, as some mothers get up in the morning. You have got full time. You have got to go to school, and see this mom kissing the kid and gently waking up the kid. Next slide. So it takes someone special to hear what a child cannot say, and we are bestowed with this special thing, a gift. Homeopathic physician, mother will understand, and we are special in a way to hear what a kid cannot say. That is through observation and through its non-verbal communication. Okay, so such a lovely petty where we have been bestowed this gift, but take time to observe. Take your own time. Let the kid just see to it that it is like a safer zone and the kid is not harmed. Let him play. You just observe. Okay. Next slide. It has been observed that when children are treated homeopathically from birth, they recover from disease and infection much faster with a very short or almost no period of convalescence. Dr. Henneman sir had given belladonna, scarlet fever, and the kid who had been prescribed belladonna didn't have relapse of the scarlet fever. And in these cases, the PNEI axis, that is pituitary neuroendocrino immunological axis, when the medicine is given below the tongue, the sublingual hypoglossal nerve is activated, then the pituitary neuroendocrine is involved, and when the metabolic functioning is balanced, in turn, it is the immunity is raised. And it is said those kids who are taking homeopathy, even if they are not vaccinated, no problem, because in turn our homeopathy deals with the immunity of the kids. So for pediatric acute cases, if one kid comes to your clinic, along with it, the whole family will come. So that is the benefit of pediatric case taking as well. So you have to gain the confidence of a kid, the treatment in their family. Okay, because along with them comes grandmother, grandfather, father, mother. Oh, what happened to the kid? The doctor, please see soon. Don't panic. Let them panic. Okay, you can send them outside. Okay, I'll see it. Let it because they want to see the welfare of the health of the kid. So they panic. That is their concern. They become emotional when it comes to a kid. Okay, so grandmother, my kid is suffering from so much time, and we have to see to it that he gets cured as fast as possible. So they may panic. But the demeanor of the physician has to be calm and composed one. Physician should be gentle, friendly, and caring with genuine interest and love for children. Toys and pictures allay the anxiety of the kid and can offer a soft toy to establish a rapport. If the kid is, say, 6 to 8 years, you can even try now doodle making. That is, they scribble. Then you can ask, what did you make? Then they will describe it, what all is going through within their psyche. So doodle making, okay? They scribble. They may even make sceneries and then explain. But you need to confirm from the child that what exactly is the drawing that he has made. Okay? So children explore what the world is about. So they also want to explore. They want to know what is it that is going around them. I had attended a session on infants in the program. So there we had discussed. Supposing if there is a table fan and you want to tell the kid not to put his finger inside as it is not safe and the kid may harm. So how do we do that? This we will take a paper and show that, see, this is what the paper will come out. So you may also get harm. So be very careful, stay away from that table fan. How does it look? So they are curious. At times we see sulfur kids. Sulfur kid, they will break the toy, entire toy. You get it today, the next day the toy is broken. They want to explore what is there inside. And tuberculinum is destructive from size, shape, colors, and other attributes. How does it feel? They will touch it, okay? And sensation, texture, temperature, etc. How does it behave? The properties. Is it soft or flexible? They try to mold it. And we also have to mold the kid just like a potter who molds the pot. But when it is wet, that time we can mold it. Once it is dried up, the potter cannot mold the pot. Similarly, during the right age, the molding of the kid is important. Okay, next slide. So it is the curiosity, observation, exploration, patience, interest, attention all comes into play when you are observing the kid. They could be curious, they may be objective or observing. They want to explore. So it is our patience, our attention, our interest counts. Next slide. Comparison. They will compare between two things. Okay. So pattern recognition by recognizing similarity and differences. Two potatoes. So they will say, okay, fine. Tomatoes and potatoes. So there is a difference. Red potato, tomato, then potato. That way they will differentiate. Okay. So comparison. Next slide. So here we start with the gist of the Erikson psychology. It is very vast, but I will just share the gist. So you see there are two columns here. On the left hand side column is the age, and then accordingly the virtues, the psychosocial crisis, what all they face during that age. That is infant to 18 months, trust versus mistrust, 18 months to 3 years, autonomy versus shame and doubt, 3 to 5 years, initiative versus guilt, 5 to 13 years, identity versus role confusion, 21 to 30 years, 39 years, that is intimacy and isolation. 40 to 65 years, we have generativity and stagnation. 65 and older, ego integrity versus despair. So this is a vast one, but today, since it is pediatric one, we will consider the first two stages, the mistrust and trust, and autonomy versus shame and guilt. Okay. So here with the basic trust versus mistrust. First, the mother, you can see the first picture is feeding the kid. Okay. So the trust that whenever need be, I will be given nourishment, care. Trust factor is developed through the bond when the mother places the kid for breastfeeding. So, but when, supposing if the mother has got to go for job and feeding the kid with bottle feed, then that trust and mistrust is broken. Then here is the seed sown for betrayal, delusion, betrayed. We have one rubric in repeat, isn't it? So from here, and if that continues, it will go on to the next stage, third stage, fourth stage. So what happens at times, mother takes the kid to the doctor and saying that, oh, we are going to have ice cream. But when they go out, they will go to the doctor and the mother will say, okay, you give him injection. So then the kid will think, you told me about ice cream and now you want the doctor to give me injection. The trust is broken here. Why don't we say to the kid that, say, these homeopathic pills, the sweet one, are good for your health. Let's go to the doctor. And even if vaccination, so we actually say when kid is on homeopathy, vaccination not required. But the problem is when the kid has to travel abroad, there is a protocol where vaccines are compulsory. So even if you have to give, why not tell the kid that yes, vaccines will be given and it's good for you. In turn, vaccines are harmful, but we'll have to convince the kid for the vaccine. So a loving, trusting relationship within the mother caregiver through feeding, teething, and comforting. Failure to resolve this conflict, sensory distortion and withdrawal. Go, mama. When I wanted you, you were not there. Now you want to come towards me. No, I don't want to. I don't want to meet you. Then that withdrawal. World is an independent, unpredictable, and possibly dangerous place. Mama, I wanted. That time you were not there. And now you're saying, come, 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 beta, come. No, now I want. So the withdrawal stage will come. Next slide. So stage 2. So this is potty training. Do fast. Finish it fast. We have to go. We have to go for the marriage function or finish it fast. The child is doing. So then say, oh, I'm taking a lot of time. Shame and doubt. You did the bedwetting, nocturnal enuresis. On the bed you did it. Shame, 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 they say to the kids. In turn, their confidence and self-esteem is depleted. So, 18 months to 3 years, early childhood, toilet training, self-control. No, I will do in the bathroom. Okay, but it so happens that bedwetting. So, autonomy, ability to control their bodies and environment. Developing physical skills, toilet training, walking, manipulating objects, shame and doubt develop when the kid is shamed or forced to be dependent in which he is capable of independence. Low self-esteem develops and dependency on the substance or people, not able to then control. Oh, I did a grave mistake. I shouldn't have done this. Bedwetting not allowed. I am being bullied. No, they say shame, shame. Next slide. Let's study a case. This is the case of a 6-year-old girl. She was very angelic, good looking, is what her mother says, and otherwise also nature was fine. But what happened is she started behaving something odd. What was the reason behind it? Because there was a newborn born in the family. All her homework copies are scribbled with crayon. Class work copies are untouched, very neat and tidy. She is not playful now as she was before. Okay. She, when asked, What is it that something changed or happened in the family? Why she is behaving like this? I asked the mother. Okay, the next slide. So mom said, we just had a new baby in the family. I delivered a baby boy, now 8 months old. And we belong to Orthodox family. There was much desire for a male child. They wanted male child. Okay. So this kid, earlier one, felt jealous about it. Mom says, I feel she got insecure due to it, and she hears good things only about the younger one. Now, younger one is born, so everybody is like, damn, attention will be given to the younger one. So this kid feels no, all the attention is given. So we have the remedies like hyoscyamus and ignatia. Newborn gets all the attention when, and see the look of the jealousy of the kid. Nobody is asking me. Everybody is asking the younger one. Go, I don't want to talk to anybody. Now, next slide. See, Ignatia 200 single dose was prescribed and there was no more jealousy feeling, and they shared a cordial relationship with the younger sibling. So sibling rivalry, okay? Confession of an elder sister, sorry for being jealous of you before you were born. I thought you coming meant for me no attention. But now, as lies on lap is your little being, I realize you're coming to my life is the best thing. So this is the feeling with the kid's eyes, okay? So earlier she felt jealous. Now I stay in Thane, Mumbai, okay? We have the Queen's necklace. This is place is at Nariman Point and it is at the Queen's necklace. So now, what is the significance of it? Once I had attended Infant Siddh program. It's a program by Rishi Prabhakar, an aeronautical engineer, well set in the state, but he left everything and here he has made his own ashram. Okay. So then there was a kid and they were sitting. There is a bench here with where you can sit at this place. Okay. So then the kid said, what is this? So Rishi Prabhakar could have given direct answer, but he chose not to give. And he said, what do you think? The kid said, I feel that it is a birthday cake with candles lit on it. So to condition the baby by giving direct answers, instead let the baby think. Okay. Then this baby neurons will develop. The brain will develop when we ask them to think. So, as is said, education is not just gathering information and facts, but it is training the mind to think. Next slide. So, from conditioning, don't do this, don't do that. You have to follow what I say. Don't you understand this elements from domination to awakening? Kids, I am there with you. You need not worry. Feel safe, secure, loved, and I will nurture and care for you. So from conditioning to awakening. Education is not just understanding these facts, but training the mind to think. From teaching environment to learning. Each day is a learning event and initiating inquiries when there is a doubt. I was said by 9:45, 9:15, you finish this session because 15 minutes will be question and answer, interrogating. Okay, there will be interrogation and discussion. So, initiating inquiry is interrogation. Like we do even in case taking, we do interrogation and then thus becoming a learner. Okay, so next slide. With this is the gist of the session, and I have deliberately ended it at 9 so that maximum time we have for further discussion. So any questions coming up from the audience wherein we can discuss?
Yes. Nice presentation. Really a thought-provoking one. Those who always insist to give some education for the betterment of life of their child, but they never gains it. As you rightly mentioned, it is the training the mind to think. we all know that, as rightly mentioned by Dr. Samuel Hahnemann, the most difficult task under the sun is thinking. And we all know that in the history of medicine, homeopathy, Dr. Samuel Hahnemann, his father always forced him to think. So from that training, we got a wonderful physician, a master. So time for discussion. Those who would like to participate, please raise your hand. We have enough time to ask some questions, because this is an
So
online.
one point
Yeah,
I
yes.
would like to add, the pregnancy history during the mother. Okay. Mother's pregnancy history also hold prime importance, because at times it so happens that, as we say, garbha sanskar, no? The psyche of what the mother is going through, all the stress, that is also reflected on the body of the baby. So that
Definitely.
also has to be considered.
There also homeopathy can act a pivotal role. There is a question in the chat box.
And somebody has asked about autism. It is a
something about autism.
It is a very vast topic in itself, but I'll give you a gist. So, in autism, it so happens that the kid is in his own world. Okay. And many a time they are not able to comprehend the cognitive, the thinking process, the rational, judiciousness, the decision making power is all gone. Then it so happens that the autism, you cannot say, they claim that it is cured, but we can at least make the kid's life proper with the thorough case taking. Okay. And it is like, I myself, we had one kid, he used to bang his head on the ground. And when there was music, okay, we had this dandiya function, okay. So then that kid would to bang his head, and then he was declared as autism. So cure, no, but yes, the life of the mother as well as the kid through homeopathy, we can at least see to it that it is smooth. And it is a very vast session, but with interact with case taking and thorough counseling, the child may even require speech therapy because of stammering, okay. And so this speech therapy will be required, and high patience, perseverance on the part of the physician, on the part of the mother, the caretaker is very, very important. So hope in future I may come up with the entire topic of autism.
How can you clinically diagnose such cases? Autism. What are the more important point to identify this autism, Dr. Raksha?
It is a score. It is a score which indicates, and along with that, the behavior. Okay, the
Yes.
behavior of the kid, that is holds prime importance. And in this, they feel that they are not able to interact with the world. Okay, so they are having their own world, and they are interacting with that. They are not able to comprehend what we are trying to say, and it gets very difficult, especially for the mother, because to communicate what the kid wants and what we actually perceive, it gets very, very difficult in such cases. But with case taking, main basic, if the mother is willing to vent out all what she had suffered during the pregnancy, her emotions, as it impacts the kid. So then through this proper case taking, we can help the kid as well as the mother and the entire family.
Yes. What about the possibility of getting a cure in such cases?
See, cure, so it is like 25%. But the main thing is we can at least see to it that the life is smooth of this kid. Cure, you cannot give a stamp that yes, I cured so and so many cases. But percentage wise, if you ask 20, but the kid life will be smooth. At least they can in turn attend a special school, or if the autism, there are stages, various stages. So if that stage is minimal, they can even attend a normal school.
Yes. So definitely we have the medicines. That is the message homeopathy can give to the world, isn't it?
Oh, it is like the entire proper case taking. So when the case taking proper, so that we can prevent any relapse of the episode, like this kid who was banging his head, and then it gets difficult for these people to control. No? So entire case taking, because it will help prevent relapse of these episodes.
Okay, thank you.
So the mental, physical, entire his craving, his aversion, his sleep pattern, his behavioral pattern with the stranger, with the family, with the friends, how the kid behaves, all will come into play.
Yes. What about the role of miasm here in the case of this autism?
What about the role of?
Miasm, which miasm, in your opinion, dominates the cases?
So it could be psychosyphilitic, basically. So syphilitic into entire destruction as well, and psychotic, the things which they see, you know, they will want it more.
Pardon? Would you clear it?
They might need it more. They will say, I want this, I want this, I want this, because they are not able to comprehend. So basically, it is like, as we say, the rubric capricious. Demands things, when which offered, they reject. Now I don't want. Because they themselves don't know that what they actually want. So capricious is the rubric. Yes.
Yes. Okay. Anybody would like to participate? Please raise your hand. It is our duty to respond accordingly. If there is no doubt or additions, then that means you didn't not
So
well. Yeah, please.
once it so happened that a female was pregnant, and during pregnancy, she heard about the father's death, and she was like into a grave shock. So Ignatia was given, because Ignatia belongs to the Loganaceae family. Shock, okay, and that kid, no, was lying still when the kid was born, okay, and they were like, why the kid is not responding? The kid was also in the grave shock. Okay, so such is the impact, and we have to be very careful, especially when the kid is interacting with the friends. The company of the friends also matters.
Yes.
Nocturnal,
Enuresis, yeah.
so nocturnal enuresis, it so happens that Adam could fear. The fear has been instilled in the kids. Like there was one case also. So in that case, the nocturnal enuresis because of the fright. The teacher scolded. Okay. So in this, how do we manage? You can set an alarm, ask the kid to get up, or before the kid sleep, 2 hours before that, liquid diet must not be given. Liquid diet. And then once you set an alarm, the routine habit will be formed, and the kid will in turn not do any bedwetting further. Okay, so the intake of fluid, then alarm could be set, and now it is like sleep talk, they say. Sleep talk is the power of the subconscious mind. So when the kid is sleep, just 10 minutes after that, when the kid is like 10 to 15 minutes into the subconscious, positive affirmation. Say the kid's name is Rohit. Rohit is a good boy. Rohit does listen to us. Rohit is very good in mathematics. Rohit makes interacts with friends easily. So this affirmative thing, along with that, will help the child evolve beautifully. That is the power of subconscious.
Up to what age this is normal, the bedwetting?
The sleep talk can be till old age as well. This much the power of subconscious. And when it comes to nocturnal enuresis, to 5 years.
5 years.
5 years.
Yes.
The sleep
Before
talk
that
is very, very effective.
Yes. Before that, it is common. Am I right?
It so happens that in states, okay, in US and all, the kids, like we send school, 2.5 years is your nursery and all. These kids are sent after 5 years in US, okay. But you won't believe, sir, I had come across a kid in 5 years of age was reciting Hanuman Chalisa.
Yes, definitely.
Bhajans and all the rhymes and all, 5 years of age. And these, they think in US and all, no, don't send the kid early, we are burdening the kid.
Yes. These are the topics beyond the limit of the present day science or the so-called modern science, I think. Nobody
The
can.
brain has got tremendous potential. That is what I said, no, during this session, the PPT, we are conditioning the brain. Do this, do that, do this, don't do that. They're conditioning. Rather than conditioning, we have to now be into awakening.
Yes. Anybody would like to participate after hearing this discussion? Please raise your hand. Dr. Ram Barveshra.
So if there is some space in the clinic,
Yes.
so ample space, if it is there, or see, even if minimal space is there, one play zone also there.
Pardon?
So that the play zone.
Play zone. Yes, yes.
Play zone for the kids. So in that the kid can play, and then the physician is observing. One more thing, between the physician and the patient, actually there shouldn't be a table. The physician is sitting here, the patient has to sit beside the physician so that there is interaction in such a way a rapport is built. But we usually tend to have a table. Even if you have a table, let the patient sit beside.
Interaction with hearts. Now, Dr. Ram Barveshra, please. After
So
drinking
that
water, please.
so that a rapport is developed between the physician and the patient. Be it kid will be playing, but otherwise they feel that one.
Yes, Dr. Raksha,
And
please
we,
wait. Ram Barveshra, sir, please.
Thank you, Dr. Manojji. Congratulations, Dr. Raksha Madam.
thank you so much.
Very good presentation.
you?
Excellent session. Excellent session.
Thank you so
शॉर्ट
much.
आवाज
sir.
आ रही ना
हाँ, आ रहा है.
हाँ very good presentation.
Thank you so much. sir.
Role of homeopathic in pediatric symptom. There are two
And-
types of There are
Yes,
two types of symptom: subjective symptom and objective symptom.
Yes.
So pediatric symptom, objective symptom is a very important symptom. Pediatric, so many kinds of medicine, pediatric symptom. So pediatric, the role of homeopathic medicine is very good.
Thanks for adding this point.
Dynamic action, pediatric. So very, very
It
thanks,
is
Dr.
objective
Raksha Madam.
because the subjective symptoms we won't be able to elicit from the kid. And whatever the attendants say, the mother say, need not be true.
Yes.
Very nice point, sir.
Attendant role of the subjective symptom and the activity and etc. Child selection of remedy according to objective symptom. So very, very thanks, Dr.
Thank you so
Raksha
much.
Madam.
Thank you so much.
Thank
It is a
you, thank you
pleasure
very
to
much.
have you. God bless you.
What is more remarkable, I think, is the potential of homeopathy to utilize these objective symptoms.
But the
Science.
thing is,
Yes.
what I was thinking, if we can approach the authorities, airport, but it is very difficult to convince that immunization part, which I said, the vaccine is made compulsory. But the thing is, they say there is a placebo effect, it doesn't work. But electron microscope, as I said last session as well, that I think vibrations in the electron microscope. But then if we can only convince them that vaccine, but better take homeopathy. But it's very difficult.
I think it is the placebo effect on their brain. It's nothing, no action from the brain. They are just telling what others telling. Dr. Abida, what is your opinion?
So it is like, see, supposing I give my example to a patient as well. So they say
Dr.
it is like
Raksha,
placebo effect.
Dr. Raksha, please listen. Now, Dr. Abida would like to comment. Yes, Dr. Abida. Yes.
And it so happens is like a placebo effect, if we say, okay, Then I give the example. Supposing if I am taking a glass of water, I am adding salt or sugar solution. At a saturation point, the salt and sugar granules will not be seen. But when you taste it, it is salty as well as sweet or not. The inherent property of that material is still there. Then how can it be placebo effect at higher density?
That's a basic mistake. What happens is that we never claims it will always contain the chemical properties of the taste. You only claims that it is capable of producing symptoms. That is the experiment or suggestion Hahnemann always putting forward. You repeat the experiments. What kind of experiment? You take the medicine, then you can prove. That is the basic mistake. We never claims it will never carry this chemical property or something taste. But what
Inherent property.
Yes. No, Dr. Abida. Yes, please.
Yes,
You can unmute now. Yes.
Okay, regarding like how Dr. Raksha said about the airport rules and everything, it's very true, but there are the strict rules, we have to follow it depending on the country where we have to travel. So there were times when we could, give a written declaration sort of. In certain places it was acceptable, but where there are real strict rules and it is we have to follow the law of the country to which way we are boarding to. So like Dr. Raksha said, we have hopefully someday there might be coming a positive effect. We can wait for that day, and until then we can just take actions what we can do regarding it.
Yes, we can hopefully look to Mr. Trump. He will make some decision in the coming days for the betterment of the humanity. Yes,
Hoping for a change.
Pardon?
Hoping for the change.
Yes, let us hope for the best. Dr. Hariharan, sir, are you there? Dr. Hariharan, sir.
Do we have Sani sir online or Bob sir?
No. This
No,
past
okay.
midnight, I think, there in Philippines.
Okay. So we can ask them to share their views as well.
Yes. Hariharan, sir, are you there? One of the senior most physician in this platform, Dr. Hariharan.
So now I would like to dedicate this session to my daughter as well, Navya.
Yes, that's
Okay,
good.
she taught me a very beautiful thing. Then she was a kid. Okay, that time her friends didn't come to play, so she was little bit sad, annoyed. Okay, so now then what to do? Friends are not there. So she wrote her feelings on a piece of paper. Okay, and then she kept it in her drawer. And it so happened that I was cleaning the drawer. I came across that piece of paper. It was written, "Today my friends didn't come to play." Okay, never mind. They must be having homework. Then later they will come. So this kid, Navya, taught me like anger management. She was getting angry, sad, annoyed, fuming, fretting, and we are like, we went out. No, so instead, write it on the piece of paper, and she kept it. Then all her feelings and emotions she wrote on that, and then she forgot about it. And when I was cleaning the drawer, I could search that. So this from the kid also we can learn so many things.
Yes, definitely it's a soric miasm, I think, maybe.
And once it so happened that she was writing and her notebook along with that on the laptop, okay, and even TV was on, okay. So it so happened, I said, "You are very busy, Mama. You don't disturb me." Okay. I said, "In which book it is given that Mama can't disturb the kid? You tell me. You give me the name of that book." Everything is not written in the book. Many of the things are written outside the book as well. This is what she tell me. So it is like they want to explore. Not only them, but we also want to explore and learn apart from the book.
Okay, Dr. Boblim, are you there or sleeping? Dr. Boblim. The time difference is the major hurdle for us. Dr. Boblim. not responding. I think the majority of cases or of patients coming to the homeopathy clinic is from the pediatric cases.
In pediatric cases, there was one case. Okay, this is the case of Dr. L.M. Khan, sir. He was my mentor as well. So it so happened that this girl had been attending school. In the dreams, she got dreams, and she said, "I won't be going to school." We tried eliciting the symptoms as well, okay, but nothing could be obtained. Then parents, we asked the parents as well. We don't know. Then we asked the dreams. Okay, the previous section also started. You must elicit the dreams. And today in the session, I said now conscious. So in the dreams, it's a gorilla with a round text. So when asked, is there anybody in the school like? So he said there is a professor with round text. And once I was in chief, that professor. So a grave in fact, a kid, echo night was given to this kid. With so much grave in fact, and that repressed what reflected in the dream.
There's a
There is
request.
some question. 1 minute.
Yes. I think, yes, ma'am, could you please share your thoughts on digital trauma in infants, parents using mobile video to feed their child over a period of time they can't take food without mobile? How homeopathy help? It's a question from our secretary, IFPH, Mr. Kiran Chand. He's a homeopathic lover.
So it so happens that in case of this kid, we must keep a time where they can use the gadgets, where these gadgets they can use. A particular time and timetable is made. No doubt the kid will not follow that. Will be adamant. I want it. Okay, mobile addiction. The mobile is taken away from the kid. The kid feels lovesick. Here also the rubric is there. Lovesick because the addiction, the love for that mobile and SIM crude was prescribed to this kid. Okay, but then the kid will not follow that time schedule, but eventually they will. Okay, so say from 11 you can use your mobile whole day, but the kid may say half that, but eventually they will understand the importance. And more if you take these kids, like we used to take Navya to library in Sundays time. Okay, so there is a shop here, they offer reading. So we would take her there and they would read the books along with us. So inculcate and develop the habit of reading. So quality time. But the thing is, now what happens is, sir, that parents themselves are sitting with the gadget. So the kids, as I showed in the session, they will copy the parents. They will copy what you do. When I was reading the book, Navya was also reading the book. I have found of reading more instead of this PDF, and then the eyes also. It's pain. I like to read hard copy. So she was also seeing that. So this way, quality time is given and a schedule. Day one they will not follow. Mind, day one they will not. Eventually they will follow.
Kiran Chand, are you contented? Or any comments, please? Please unmute.
Dr. Kiran Chand, are you convinced? Okay. So give the feedback for the session as well.
Thank you. It was very good. A parole was going on, so I was keeping myself unmute for some time. Sorry, mute for some time.
Yes.
All best wishes to you.
Yes.
Thank you. I have a small kid, 9-month-old.
Okay.
But
so
not for
he is addicted to mobile.
Sorry?
The kid is addicted to mobile.
No. She's not. But I have seen some relatives feeding the child with the mobile on.
So this way we can help the kids. And anti-crude, like you have to take the entire case and accordingly prescribe. But usually this is seen in my clinic.
Okay.
Yes.
Thank you.
And
Thank you.
even one kid during COVID time, the father and the kid, father had been outstation. They couldn't meet each other, and the kid was
Okay.
missing the father. So there also love sick and anti. So that way we can apply. So here it was for mobile. But kid love mobile. The guy was and he gave and to this kid and he was.
There's a question chat box.
Okay, this is a very good question asked. Ma'am, how to increase the kids' appetite and love to food? Usually what happens, Dr. Nazia and sir, that it is the anxiety of the mother as well. My kid is not having food, no nutrition, and I'm feeling still weight is not increasing. Okay, give me some tonic, doctor. It is your anxiety. The kid's weight is proper according to the age. Okay, so first educate the mother that when the kid is healthy, it don't panic, no anxiety. The kid weight, they are not putting in weight. Okay, and see kitna dubla ho gaya mera beta, kitna patla, so much thin. So it is basically the anxiety. And add more of colorful food, not the artificial one, not the preservative one, natural one, and so that the kids will feel it colorful and it has more of antioxidants as well. So add more of colorful natural food, okay, not preservative one. And those colors which we get, they add no, so amplify the taste, the nutrition, and all the colors not needed, natural. And more of colors, more of antioxidants, which will help combat infection.
Yes. In brief, I think the parents should be able to tell, my life is my message. That's the most important thing. And I think we have to wind up the session in 2 or 3 minutes. Anybody like to participate or add something? You can please raise your hand. So what often the child observes the parents and just imitate them. So if the parents are always using this, they are addicted to the devices, then quite natural. Their children also will go in that way. So that they cannot criticize the questions or them. That's the most important thing.
In kid case, no, somebody has asked which potency they use. So
Yes.
in kid, we must use 30 potency, low potency for kids, okay? Because their vitality is not much high, okay? So it is low. So 30 potency, even in old age, geriatric, 30 potency. When it comes to our age, like middle age and all, then I usually use 200 potency. For old age, 30. When the mentals are high, it is higher potency.
Yes.
Pathological cases, it is again lower potency.
Okay, in case of sucklings, it never receive medicine, but instead of the wet nurse or mother should take the medicine and feed the child. Kind wind up session may invite Dr. Abida to express word of thanks. Yes, please, Dr. Abida.
Okay. Somebody has asked me, I have got 2 minutes more. Then starts the Malayalam session, I feel. So, ma'am, how much the fight between parents affect the discord between the parents? Okay. So let me share one quick short case. So this kid was separated from the mother, okay, because the kid was under and then was kept in an incubator. So it so happened that after the delivery into the incubator, and then after that, the mother had to go for work. So the kid was like this way. The kid would, you don't come to me. Then lac humanum was prescribed to the kid because of the vacuum and lac.
Yes.
Humanum. And then the mother was juggling between the household chores and the job, okay, and could not give much time. And weaning was like given immediately from breast milk to bottle feed. So lax humanum was given to the kid. Do read
Okay.
about lax humanum.
Yes, thank you, Dr. Raksha. Dr. Abhida, please express
Thank
more
you,
amount of
Doc-
thanks. Yes.
Thank you, Dr. Raksha, for sharing your perspectives and tips regarding pediatric cases. And thank you for sharing your valuable time. And thanks to all the participants who have been staying along with us to attend this session with us. Thank you. Thanks a lot.
It is always a pleasure to share the cases with my IPH family.
Okay. We are always keeping our time, though, so kindly cooperate with us. With our remark, let me conclude today's English edition. Hope we will be back again tomorrow. Till then, goodbye.
It is all known people and family. Thank you so much.
Yes.